to try and explain what we've been doing from a commissioning perspective. We've been having a discussion, a few of us, just around understanding the commissioning landscape in England, and that's extremely complicated, so I'm certainly not going to be able to take you too far down that journey this afternoon. I'm certainly not going to try and attempt to explain the landscape. I'm not going to tell you anything new. I'm not going to tell you anything that you haven't heard from Tom, Ali, Richard and other people that have been involved in the work in Doncaster. But what I'm going to try and do is just try and explain from our perspective as a health commissioning organisation our experience of working through this cancer survivorship work. Just to give you a real quick flavour of Doncaster, the community, we have a registered population of 300,000 people. We have, see 2,500 newly diagnosed cancers a year. We see around 9,000 patients referred urgently by the GP because of symptoms of cancer. We currently have around 10,000 people living in Doncaster after a cancer diagnosis that we expect to increase to 20,000 by 2030. Cancer is a priority in our CCG. It's one of our 5 corporate priorities. And it's a decision we took when we were looking at the needs of Doncaster as an organisation before we got authorisation, about 2.5 years ago, 3 years ago this autumn. We know from the work that we've done with Public Health England that cancer is a priority because of a range of issues. So we've got poor population health. An example of that is we have 15,500 more smokers than any other area that's similar to our levels of deprivation. Because of our poor population health, we have a higher incidence of cancer. We have worse outcomes for men, particularly in lung, colorectal and prostate cancer, for women in lung and breast. We have high premature mortality rates in lung and breast cancer. And because we aren't treating as many patients as people as you would expect to see in an area of deprivation similar to ours, we needed to refer more patients. So we needed to refer more patients to be able to pick up those patients and treat the right number of people. We also know that we need to reduce emergency admissions and presentation and increase breast and cervical screening. Now, a lot of those issues are very similar across other areas, but we seem to have some particular issues in Doncaster. And the work that we did with Public Health England helped us focus our work and look particularly at certain tumour sites, but also focus our work on looking at increasing treatment. So particularly around the survivorship work and our perspective really on the work that we've been involved with, I'm extremely proud to have been involved in the work. It's been led by, as you've heard already, it's been led by the outcomes that have been defined by people affected by cancer, which is a very different way of working for the CCG. We've had direct involvement in some of the tasks, in some of the pieces of work that have happened, and we've taken a real step back, and we haven't been, would have had no involvement in some of those pieces of work. And that's certainly not surprising through what you've heard today, and what is obvious, that the cancer journey and survivorship is about much more than the cancer. And for me, from a CCG perspective, it's about us trying to balance the pathway. So trying to ensure that the work that we do around survivorship is equal to the work we do around prevention, first contact, around diagnosis and treatment, and end-of-life care. So we're responsible for that whole pathway. And one of the questions that we've talked about internally within our organisation is how much time do we spend talking about 62-day cancer targets and other cancer targets around treatment compared to how much time we spend talking around cancer survivorship. As an example, we've taken a lot of action over the last 2 years to increase referral, increase awareness, increase early identification and referral and treatment. As a result, we've seen over the last 2 years a 12% increase, and nearly 450 more people have had their first treatment for cancer over the last 2 years in Doncaster. Now, we don't expect that trajectory to continue, but that level of additional activity is certainly not sustainable. So we have no choice. We have to do something different, and we have to work differently with our providers of clinical services. So you've heard about all the examples of the work that have gone on in Doncaster, the wonderful work that Ali has led with Cancer Buddies, around redesigning the work with Tom and through Macmillan, our existing services like Living Well. We've been working on the risk stratified pathways such as breast, prostate and colorectal cancer. We've been doing work to implement the recovery package, and we've also been doing work with around professional education, supporting our GPs to understand the concept of survivorship and what survivorship means for their patients. So we know that we've got increased numbers of increased treatment, more people are living beyond their cancer. And the traditional approach from a CCG, from a clinical commissioning group, sort of target-driven approach would be to count the numbers of survivors. But we've got to really reframe our thinking, and some of the discussions we're having within our own organisation is trying to get to understanding the real outcomes. So we're talking about enabling people to lead a full and productive life after diagnosis. So then you start to unpick some of that and start to talk about, again, what does that actually mean? That's very individual, very personal to every single person that we see in Doncaster. But the real outcomes are about enabling a full and productive life, about family life, being a grandparent, being a parent, having increased resilience because of your experience, increased sense of purpose, and also the economic contribution that all of us make. Clearly, that's balanced against the risks of recurrence, the side effects of treatment, things like the emotional and physical impact of a cancer journey. But the challenge for us all is to be able to identify those people who might need an extra bit of support, who need support at the right time, enable those individuals to access support when they need it. That's all I wanted to share from our experience.